Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hi, everybody. I'm Dr. Mary Ann Pinkston, and welcome to The Better Life with Dr. Pinkston. As usual, we are going to bring you a fantastic show, and I am going to go a little different direction today, which I am thrilled about. Got a fantastic guest. We're going to talk about eye health. And so I have Dr. Rani. You said Bennett. I want to make sure I say it correctly because I am notorious at ruining names. So Rani Bennett, and she is an MD and neuro-ophthalmologist that has Envision Health up in New York City. So she's coming to us from New York City. She's known as Dr. Rani, so that helps me in the name department. Bless your heart. And also has a great book, Beyond Carrots, Best Health Food from A to Z. And also she's coming up. She's going to have an eye summit, which we will talk about, and will be great for the general public to join, as well as providers and people in the medical field. And she is wonderful. She's been seen on Good Morning America and CBS Evening News and New York Times, and has been all over. And she is a wonder in integrative medicine and eye health. Dr. Rani, thank you for joining me. I'm so thrilled to have you on.
Oh, thank you so much, Dr. Pinkston. I'm so excited to be here.
It's a wonderful morning. And so listen, eye health, this is something that is so important. I think it's kind of like dental too. Nobody really pays attention to the eye. Nobody really pays attention to the mouth, and we don't realize how important eye health is. So let's delve into that this morning. First, tell me about you and where you are and how you came to do neuro-ophthalmology.
Yeah, so I started off doing ophthalmology. So I did a residency in ophthalmology where I learned all the medical and surgical skills necessary to treat eye disease. And I was always still interested in neurology. I love the way the brain works, the complexity of it. So I ended up doing a fellowship in neuro-ophthalmology. And what that is basically it's a subspecialty of ophthalmology that deals with all the connections between our eyes and our brains. And many people don't realize this, but first of all, we don't see with our eyes. We see with our brains. Our brains process all that information. And the other really interesting fun fact about this is that over 50% of our brain's networks are related to our vision in some way, whether it's processing motion or color or resolution or contrast, whether it's moving our eyes or our eyelids. That's all controlled by the brain. And again, over 50% of our brain is visual. It has to do with our visual system. So I loved it. And so I did that for many, many years in academics. So I still am. Associate professor at Mount Sinai here in New York City. And then in 2017, I took a little bit of a kind of a side, I don't know how to say it, but like a different path where I started to really get into functional and integrative medicine. And I ended up getting certified in functional medicine. And then I started to use those principles for my patients who had vision issues, who had eye disease, whether it be cataracts or glaucoma or macular degeneration, or even something like dry eye. I began to use functional medicine principles based in nutrition and lifestyle and supplements and botanicals and stress modulation, which most eye doctors don't talk to their patients about. But I feel like it's a really important missing piece of eye health. And this is really my passion. And yeah, that's how I ended up doing what I do today. So I have a private practice in New York City, but I still also have my academic appointment because I love to teach. I still teach our residents, fellows, medical students on a regular basis. So it's a really nice balance of both worlds, private practice and then staying in academics.
As it should be. And pass along those pearls and that knowledge to the next group, because I feel like they are all going to be AI driven, and we've got to do our duty, and I do a lot of teaching too. We've got to do our duty and pass along this good information. Isn't it amazing when the integrative light bulb goes off, functional medicine light bulb goes off, it goes on, you can't turn it off. And everybody has a story behind their functional medicine experience. It's usually a personal story. As you know, I have rheumatoid arthritis and dry eye, and I've been dealing with that for so long. And that's how, it's always something personal. It brings you to light of what you need to do to take care of yourself. And eye health is certainly complicated.
Yeah, I have my story as well. My personal story. I can share it if you like.
Please do.
Yeah. So, in the midst of, working in academics, it was very demanding, seeing patients, doing surgeries, teaching, doing clinical trials. I really wasn't taking care of myself, as many doctors do. They just don't self-care is not a priority. And I developed, I had migraine before, but I developed pretty severe migraines. And basically it became a chronic migraine where I would wake up every day with a migraine and go to sleep every day with a migraine. And this went on and on and on for weeks and months. And then it became years. So I had a chronic daily migraine for over 3 years. And I tried everything under the sun that my conventional doctors gave me, all the latest and greatest medications, nothing worked. And then I decided, I said, I need to do some research. There must be some better way to treat my migraine. I can't live like this for the rest of my life. And then I discovered the studies looking at magnesium and riboflavin. And I was thinking, how come none of my conventional doctors ever talked to me about this, supplementation? And then I was talking to another colleague who then said, well, have you ever considered doing an elimination diet? And I said, whoa, what's an elimination diet? I had never heard of it before. And so he went on to explain to me what that was. And then he introduced me to functional medicine. He's like, I went to this conference in functional medicine. It was all about mitochondrial health and energy production. And maybe you should go to this conference and try to see if there's an issue with your mitochondria in your brain. And that's why you have migraine. Or maybe you're not making energy properly. How can you boost those pathways? So I went. And I fell in love with it. And also it was that light bulb going off oh my God, I was never taught this in medical school. Why were we never taught these approaches in medical school? It's such a foundation of health. I ended up getting certified. So that was my personal story into how I started off with migraine, finally started to get better once I made all of these major lifestyle changes and nutritional changes and the supplements, stress moderation, better sleep. All of that played into helping to improve my migraine. And I'm in such a better place right now because I discovered functional medicine.
Yes. And it's so are your patients and everyone, your students and everybody around you for doing it. I applaud that. I'm so sorry. Migraine is horrible. And that could be a whole show in itself. That's for sure. So, well, as we kind of focus on eye health today, I know one of the factors that affect eye health are all of the screens and games and iPads and computers, TV. How does all of this affect our health? Head to toe.
Yeah. So, screen time it's an epidemic. We're all on our screens. We're glued to our screens. Some studies estimate that adults spend anywhere from 7 to 10 or more hours a day on screens, including myself, probably many of us. Yeah. And for kids, it's about 6 hours a day on screens. So no matter your age, you're probably on it. You even see toddlers, looking at their iPads in restaurants, et cetera. It's inevitable. So the good news is that there is no permanent damage done to your eyes from being on screen. So that's the number one thing I want everyone to understand is that there is no permanent damage, but there can be many short-term side effects from being on screens. And we call this, in the eye care world, we call this digital eye strain. It's a syndrome. And basically, it can have different symptoms like blurry vision, trouble focusing on your screen, maybe dry eye, like you mentioned earlier, light sensitivity. A lot of people have light sensitivity from the blue light coming from the screen. Sometimes people even have headaches or even migraine from being on screens all day, and even neck and shoulder pain just because of our position, because many of us are hunched over our computers. Yes. So this is digital eye strain, and there are some great ways to treat it. It's a lot of it is just, being mindful and doing a couple of things to modulate your screen time. So I can go through what they are if you'd like.
effective solutions today.
Yeah. So I have 5 tips that I share with my patients when it comes to screen time and managing that and preventing eye issues. So number 1 is something called the 20-20-20 rule. And many of us, when you hear 20/20, think about perfect vision, but this is actually a little bit different. This means that set your timer every 20 minutes, take a 20-second break and look at something, not at your screen, but 20 feet in the distance. Okay. And what that does is it relaxes your eye muscles. We have muscles inside our eyes. They're called our muscles of accommodation. And they're constantly working when we're looking at anything up close, whether it be your phone or your computer screen. Those muscles are constantly working, and they're not meant to constantly work like that. So you're giving your eyes a little bit of a break every 20 minutes by just not focusing up close. So that's number 1. Number 2 is simply by blinking more. I'm going to have you guess, Dr. Pinkston. Do you know how many times we blink a minute? Like, take a guess.
Oh, I would say 10 times a minute, probably more than that. If I really think about it, we probably do it every couple of seconds.
Yeah. So most people blink about, you're close, 15 to 20 times a minute normally. Yeah. But when we're on screens, that blink rate goes down to 3 to 5 times per minute. Wow. Right. So we're not blinking because we're just so focused on what we're looking at. Our brains just don't remind our eyes to blink. And so our eyes dry out. When you blink, you're spreading the tears over the surface of your eye. You're lubricating your eye. But when you're not blinking, those tears start to evaporate. And it's basically leaving the cornea, which is the surface of the eye, very, very dry. And so just by blinking more, like mindfully blink, just remember to blink. And also once in a while, maybe when you're doing your 20-20-20 rule, you can do like a forceful blink like this and really get those tears flowing and get the tear glands like secreting oils and fluid, et cetera, et cetera. So that's very, very important, is just blinking. So that's number 2. Number 3 is moderating the blue light coming from your screens. So blue light is everywhere. It comes from the sun. It comes from our devices. It comes from LED lights, CFL lights. Blue light is everywhere in our world. But blue light can interfere with circadian rhythms, making it harder to fall asleep. But it can also cause, again, light sensitivity sometimes for some people. It can trigger migraines. It can make them have eye strain and fatigue. So many people turn to blue blocking glasses to block the blue light from their screens. There's actually no proof at all that blue blocking glasses actually help. Zero proof. Wow. They've done studies. No study has shown that blue blockers actually work. So if your optician or your optometrist is trying to sell you blue blockers on your glasses, just say politely, no, thank you. I'm okay. Unless you really have sleep problems. That's a different story. If you have a lot of sleep issues, that you have trouble falling asleep, get your blue blockers, but get the really dark ones, because then you know that it's blocking out most of the blue light. Most light-colored blue blockers only block 20 to 30% of the blue light. So they're not really doing much, and maybe that's why they don't work. And maybe that's why the studies haven't shown that they work. But if you are going to get them for sleep, get the deep ones, like the deep red or orange or amber. But getting back to blue light, the best way to block blue light is just to put the settings on your phone or device to remove the blue light. That's the best way to do it. Okay. No matter what device you have, there'll be settings there.
I did not know that. Okay, good.
Yeah. So whether you have an Apple device or an Android, it doesn't matter. Each phone platform will have some filter, that internal filter. But also there are apps that people can use that will also remove the blue light and also adjust the light from your screen to match your environment. So your computer, when the filter, the app will know when the sun is rising where you are, when the sun is setting. So it'll modulate the amount of blue light to match that coming from the sun, which is really phenomenal that we have technology that can do that. Like, you don't have to program it. It already knows. But that would be something to consider, is to do like download a screen filter. And all of these topics.
I tell people to, turn their devices and everything off at least, an hour or two before bed. That doesn't happen. I don't do that. So I
don't do that either. I'm so guilty of that. Yeah.
Beautiful. Very good.
Yeah, but put again, like depending on the phone you have, it can be night shift mode, or I forget what the other mode is, but look around, you'll find it. And I was saying that all of these topics, we go into deep, like really a deep dive into all these topics on the iHealth Summit, which you mentioned earlier. So thank you for mentioning it, Dr. Pinkston. But we help to people to understand what do they really need to do to keep their eyes healthy. So blue light is a hot topic. Dry eyes are a hot topic. Eye strain, screen time is a hot topic. So we have lots of speakers talking about this on the summit. Yeah. Okay, so now we're up to number 4, which is, this may be interesting for some people, especially if they have young kids, is to spend more time outdoors. And, you would think, okay, of course, if you're outdoors, you're probably not on your screen, but maybe you're looking at your phone, but not, as intently. But there's something else to it. It's not just not looking at your screen. Studies have shown that young kids, now, first of all, across the world, there is an epidemic of myopia, which is nearsightedness. More and more and more people are becoming nearsighted. And we think it has to do with the demands of up close work screen time. And it's actually estimated that by the year 2050, 50% of our population is going to be myopic, which is crazy to think that. Wow. 50%. And we know from studies that kids who spend time outdoors, at least 2 hours a day outdoors playing, whether it being during school recess or after school, it doesn't matter, they have reduced rates of myopia progression. Wow. So simply by getting out there, maybe it's not being on a screen, or maybe it's the sunlight, helping eye development. We don't know yet, but 2 hours a day. And there's actually countries where they now mandate 2 hours a day for kids during their school day, which is great.
Very good. Absolutely.
We have yet to do that in the U.S., but
I was constantly when I was a kid. Now that just doesn't happen. Safety issues, the increased demands of schools, things like that. But wow, that's great. Good.
Yeah,
good.
Same here. I grew up playing out on the street. Like rarely did I come inside, and we had video games like Atari had just come out. So I would play some Atari once in a while, but the majority of the day, especially in the summertime, I was outside. That was my childhood. But the kids these days are so different. It's the opposite. Yeah. So get your kids outside and go outside yourself, get some fresh air, take a walk in nature. There's just so many benefits of being outdoors. Okay. Now, number 5 is nutrition. And so this is like one of my favorite topics. It's my passion is ocular nutrition. And this also came from functional medicine once I learned about nutrition. But basically, a lot of people think that if you just eat some carrots, you'll be fine. Your eyes will be fine. You'll have that 20/20 vision, but you actually need a diverse range of nutrients. And some of those nutrients can actually protect your eyes. They act like shields for blue light and UV light. So it's almost like having blue blockers inside your eyes or sunglasses inside your eyes. These are nutrients. They have kind of fancy names, but you may have heard of them because they're found in supplements also. They're called lutein and zeaxanthin. And they're great for your eyes because they get deposited right in the macula that's supposed to give us our 20/20 vision. They protect us. They're antioxidants, and they protect against screen time and also macular degeneration. So eat lots of foods that are rich in lutein and zeaxanthin. So what foods are they? Well, I talk about all these foods in my book, Beyond Carrots, Best Foods for Eye Health A to Z, but leafy greens are my top choice because they have the highest concentration of these nutrients. So kale, spinach, collard greens, any kind of green really has high concentration. So that's a great source. Also, yellow and orange foods. So for example, yellow and orange bell peppers. A lot of people, when they cook with or choose bell peppers, they buy the green ones. I always tell them, no, opt for the orange and yellow ones because they will also protect your eyes. They have really high concentrations of lutein and zeaxanthin.
The red ones?
The red ones? Not so much. I mean, they have other nutrients, but not so much. So orange and yellow, I know they're a little bit more expensive, but you know what? It's worth it. It's worth it. Your vision is worth it, right? Egg yolk is another great food because it's the beautiful orange color of the egg yolk is from lutein and zeaxanthin. So I always recommend, if they eat eggs, I recommend them to have eggs in their diet. And there are some spices also like paprika and cayenne pepper also have some of these eye nutrients, lutein and zeaxanthin. So there's lots of foods to choose from. And I have a lot more in my book. So if you're interested, I go through the whole alphabet A to Z, talking about like what are all the foods that have some of these, amazing eye nutrients. So you can find a diversity. So if you don't like leafy greens, there are other options that you can choose. Right. But yeah, so those are my 5 tips. The 20-20-20 rule, blink more, use a screen filter app or set your settings on your phone or device, get outside and eat lots of nutrients or eat foods that are rich in these eye nutrients.
Absolutely. And get that book because that is amazing. There's a lot of great information in there for eye health. And I think I have noticed a growth in areas of autoimmune disease with dry eye. I've noticed also an increase in macular degeneration diagnosis. And so I don't want to get too far off topic with that, but I don't know if that's something that you have seen as well. So do those nutrients help in that regard as far as prevention of macular degeneration?
Absolutely. And actually, there was a really big study done in Europe for macular degeneration. And they looked at over 4,000 people. They followed them out over time. And they found that people who adhered to a Mediterranean style diet had 47% reduced risk of macular degeneration. 47%. It's crazy. Yes.
Wow. As well as a reduction in heart disease and diabetes and other things, reduction in weight. So, always falling backwards to a good, the Mediterranean diet is an easy choice to make. We're not talking about Atkins. We're not talking about, pescatarian necessarily or things like that. Just simple Mediterranean diet. So that great information. So I know we are coming up on a kind of a natural break. I've got a great sponsor, Magna Pharmaceuticals, and so I'd love to pay homage to them. But please tell us, and all of this will be on the website. Please tell us where we can find you.
Yeah, so my website is my name, drranibannock.com. And also, if you want to sign up for the Eye Health Summit, which is coming up in May 1st through May 7th, you can go to our website, theeyehealthsummit.com. Remember, put the front in, before theeyehealthsummit.com. You can register. It's completely free. You're going to learn so much. I have 36 speakers I've interviewed on their areas of expertise. They share their insights. They share their years of knowledge. And you can look on the website, you'll see all the topics that are listed, some of which we talked about today, like eye strain, dry eye, macular degeneration. But we also talk about cataracts and kids' eye health and astigmatism and retinal injuries and sports injuries. How do you prevent them? First aid for your eyes. There's so many great topics in there. So please join us and tell your friends and family too.
Absolutely. That will be on my website. I will provide a link there so people can go and sign up. I'm signing up. I want to hear all about it. So, because I don't get a lot of eye health, training in medical school. And so this is very important, very important. So we will have that at drpbetterlife.com. And you can find all my previous shows, but you can find this one and links to her book, her website, and to the Eye Summit, which we'll do. We're going to take a short break and be right back on the other side. See you in just a second.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Welcome back, everybody. Thank you for tuning in. Better Life with Dr. Pinkston. I'm Dr. Marianne Pinkston here with Dr. Rani. So she has been giving us some fantastic information about eye health, which I think is extremely important. And I want to diverge just a little bit. I have personal interest in this for dry eye. Definitely becoming more and more of a difficult issue for people. And so let's go there. I know there are different, reasons for it. We just talked about one with, the exposure to screens and the time for fewer blinking and whatnot, but autoimmune illness. And this has a big nutritional backup to it too. Tell me a little bit about, dry eye and how it occurs and why people are battling it more and more these days.
Yeah, it's so common, and many people think that it's only something that happens when you get older, but it can happen at any age, even in kids. I've seen children who have dry eye, especially from being on screens. There are really two types of dry eye, or two main categories of dry eye. One category, which is the larger bucket of people, is that they produce enough tears, but they just evaporate too quickly. And that's kind of what I was alluding to before, is the tears just evaporate. And they evaporate too quickly because in most cases, we have these tiny little glands in our eyelids. They're called meibomian glands. They look like little fingers. We have about 25 to 30 glands in each eyelid. And those glands are not secreting oils or secreting healthy enough oils. And so the tears are evaporating. And to manage that, we know that you mentioned nutrition is really important. We know that omegas can make a big difference. So specifically omega-3s. And so there are studies that have shown, there was one study called the Women's Health Initiative that looked at, I think over 30,000 nurses. And they found that the people who had fish at least twice a week in their diet had a reduced risk of dry eye. And the fish that were, that had the most benefit were actually tuna and salmon, I believe, from that study. So have your omega-3s. If you don't eat fish, you can get them, from some plant-based sources or from supplements. But also, we also recommend for the eyes, when to promote oil production and keep those glands healthy, we recommend hot compresses. And many people think that, they can just run like a little washcloth under warm water and put that on their eyes. That's not enough, unfortunately, because we need the heat to really be retained and to get to those glands. So I always recommend getting a professional grade like eye mask. They're not expensive at all. I have a few on my website that I trust, companies, but basically you heat it up. We can put it in the microwave, or you can put it in a steamer, heat it up if you don't have a microwave that way. Put it on your eyes for about 5-10 minutes. And that heat will get to the glands, stimulate oil production, and get the glands to secrete healthy oil so they don't get clogged. Many people actually, when the glands get clogged, they get styes. And people don't realize that they're getting styes because their glands are not healthy. And so warm compresses are the way to go to prevent that from happening. There's a lot more people can do for that type of dry eye, but I want to also just mention the other type of dry eye, which is aqueous deficient dry eye, which is kind of a fancy term for basically you're not making enough tears. And you mentioned earlier, Dr. Pinkston, autoimmune diseases. And there are a couple of autoimmune diseases that can underlie that aqueous deficiency dry eye. So one example would be Sjogren's disease, where the body creates antibodies against the tear glands, which is up here. We have these eyelid glands, but we also have the major tear gland that's kind of under the eye socket up here. And so in Sjogren's syndrome, people develop dry eye because those glands can be attacked by an autoimmune process and not produce enough tears. We have testing for it in the office that we can do. It's called a Schirmer test. To see if someone is not making enough tears. And there are various treatments to try to increase tear production. So there's various drops that can be prescribed to help improve the production of tears. So I think the very first thing is if you have dry eye, if it's mild, you can just use some drops over the counter. But if it's more of a problem, then definitely talk to your eye doctor about, okay, which type of dry eye do I have? Do I need extra testing done? Do I need to be tested for an autoimmune condition? And also, ask your doctor for like a stepwise approach. First, try the simplest thing, the least invasive, then move on to maybe prescription drops. And now we have all kinds of other technologies and procedures we can do for dry eyes. So that's kind of more for refractory people who are not responding to the other treatments.
Right. Absolutely. And I'm definitely one of those. So what about eye drops? I know we have a lot of allergies, watching screens, dry eyes. Do people do damage when they use some of the over-the-counter eye drops? Which ones do they need to stay away from?
Yeah, that's such a good question, Dr. Pinkston, because I don't know if anyone remembers, but about 2 years ago, this was all over the news that there were recalls of these eye drops. And these drops were over-the-counter drops, marketed for dry eye and sometimes even allergy. The issue was that they were contaminated. And some of the bottles were contaminated with bacteria or fungus. And there were reports of people getting serious eye infections from using contaminated drops. And unfortunately, there were even reports of, I think, at least 2 people who died because the contaminated bacteria, the drop went into their system, got into their blood, and they developed sepsis and pneumonia. So it's crazy to think that people could die by putting in contaminated drops, but it did happen. This is again back 2 years ago in 2023. So the FDA keeps a list of all the recall drops. So if you're worried, definitely go check it. But there's even since then, there have been many, many more drops that have been recalled. Now the FDA is coming down really, really hard on these companies. They want to make sure that they're using sterile practices in their manufacturing plants, that their whole process is safe. But there still are recalls. Like I think just a few months ago, there was another brand that was recalled, which was Systane Ultra. Now, Systane is a really well-known brand. It's not a generic. It's actually comes from a reputable company, but it was contaminated. So, so just, I would just say, what's that?
I said I could actually pull that out of my purse right now. Honestly, it's people
Systane Ultra.
Yeah. Absolutely. So,
okay. Well, definitely not all of it was contaminated. There was a specific lot number that was contaminated. So hopefully you don't have that lot number, but please check.
You brought up a great point of going to the FDA website of recalled, medications. They have not just eye drops, but many, many different meds listed of vitamins and things that have been recalled. So it's a great point. Thank you. And I can include something like that on my Linktree social media wise, because that's a great point. Thank you.
Yeah. I don't think people realize that, they think that, they're doing something good for their body, right, by taking a drop or taking a supplement, et cetera. But there can be some risks. So just be a little cautious about that.
Absolutely. And 2, they can increase, I know with allergy season, some of the anti-allergy eye drops can also increase the dryness. And is that true? Are there types that do that?
Yes. Yeah, I'm so glad you brought that up. So there's one particular drop that a lot of people turn to when they get allergies or red eyes, and that's Visine.
Yes.
And unfortunately, most Visine is a no-no in the eye care world. Most eye doctors will not recommend Visine. What it does is basically it has an ingredient that constricts your blood vessels on the surface of your eye. So it makes the red go away. It does get the red out, but people can become kind of, if they're using it daily, they can become dependent on it, even not responsive to it. So as soon as they stop using it, the blood vessels dilate like crazy and their red eyes get worse. And then so they feel like, I have to keep taking it. So it's almost like it becomes addictive in a way, but it doesn't really solve the problem. And as an integrative provider, as a functional medicine provider, I always try to solve the root cause of the problem, not just put a Band-Aid on it, which is what Visine does. It just puts a Band-Aid on the redness. Instead, figure out where the problem is coming from and try to address it from its root cause, whether it's some kind of environmental allergy or something else. Find out where it's coming from, talk to your eye doctor, work with your ophthalmologist or optometrist, and then have a plan in place. Like try a few things, and simple things, especially because allergy season is coming. Simple things people can do is if they go outside, wash their face at the end of the day, like get all those allergens off their face. And, if they, they're outside in pollen and it's in their hair and then their clothes, wash your hair, wash your clothes more regularly, change your bedding, get a really high quality air filter, put it right by your bed at night. Simple things people can do for eye allergies. And there are drops that work really well. Some are prescription, some are over the counter, some are prescription. But also sometimes people take oral medications for allergy, and that can help their eye allergies too.
Absolutely. I love that little azolestine nasal spray. I hope that's not something that affects the eye too much, but that's another thing that can work really well. Very, very, very great points. Thank you so much. And I know that we could probably go for a couple of hours. There's so many topics and questions I have for you.
There are. Yeah. But that's what the Eye Health Summit's all about. Like, when you go see your eye doctor, you'll probably only get maybe if you're lucky, like 10 to 15 minutes face-to-face time with your eye doctor. And there's only so much information they can share with you during that visit. But this is a way to get, the full resource library, what you need to keep your eyes healthy, from nutrition to lifestyle to sleep, supplements. We talk about it all. So please join us if you can.
Yes. And we will have a link on my website so that people can go and sign up. Please do this. I'm going to be there. This is a great, great topic and very, very important. So do not set your eye health aside. And so you can go to give us your website again so people can find you.
It's drranibanik.com. So DRRANIBANIK.com. And it's also theeyehealthsummit.com to register.
Excellent. I know she has a podcast and their book, so many things. I'm going to have access to all of that. If you will go to drpbetterlife.com, you can catch this show and all of her information, as well as 3 years of other topics, which is wonderful. And I appreciate you coming on today so much. I hope I can invite you back again at some point. We can do more eye topics. Very important.
I would love to come back, or maybe we can talk about migraine next time, because that's also a favorite topic of mine. I love talking about migraine as a patient and also a doctor who treats. I treat a lot of migraine in my practice as a neuro-ophthalmologist, visual symptoms of migraine. So I would love to talk about that. And I would love to have you on my podcast as well at some point, on the IQ podcast.
Absolutely. I would love to do that. So I consider it done. Absolutely. Migraine is a great topic. I have so many patients who suffer migraine. I have suffered migraine. It's an incredibly important topic. So yes, we will absolutely do that. And thank you. So I thank you again. It's been such an honor to meet you and have you on. We will do
Same
more.
Here. Thank you so much.
Absolutely. And everybody take care of your eyes. Go to the Eye Summit, go to my website, and you'll find it there to sign up. And thank you. Have a fantastic day.
You've been enjoying The Better Life with Dr. Marianne Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.